So before we get started, I want to take the opportunity to welcome our guest speakers. Thank you all so much for being here today. We have Erica Guzman and Joseph Byrum. So Erica is a licensed master social worker in the state of Texas and obtained her Master's of Social Work degree from SFA. Previously, she's worked as the Director of Children's Prevention and Education at the East Texas Crisis Center for nearly 10 years. And currently she serves as the Director of Mental Health Programs at Next Step Community Solutions, and she oversees mental health counseling and the program, as well as the suicide prevention program. Joseph serves as the Director of Prevention Programs at Next Step Community Solutions as well, and he manages all the substance use prevention and youth development programs, and earned his Master of Public Administration degree from Texas A&M. So without further ado, giggle, am I right? So please help me welcome.
Thank you.
All right. Awesome. Very cool. How are y'all? Good noon. Is it saying good afternoon?
Good noon.
This is Erica. I'm Joe. We're from Next Step Community Solutions. Have any of y'all heard of us? That's okay. It's a common thing. I'm trying to click.
Oh, it's not working?
On the first one?
Can only get better.
How embarrassing.
There you go.
There you go.
Okay, cool.
There you go.
All right, so today we're going to talk a little bit about who we are, what our programs are, and what you need to know to be a trusted adult. We'll go into that. Thank you all for coming. We really appreciate the opportunity to share our work and some information with y'all. So first of all, Next Step Community Solutions. We've been around since 1984. We are a leader in school-based mental health counseling, substance misuse prevention, working with school-age youth. That's, as you can imagine, we're really gearing up for our busy season. Summer's kind of a low season for us, but we do mental health programming, we do substance misuse programming, we do suicide prevention programming. We'll be a little more in detail about the mental health side. On the substance use prevention side, we have coalitions. So we work with adult community leaders to drive strategies forward to reduce youth substance misuse. So it could be things like planning a Red Ribbon Week, what we want to do at the schools, hand out information, or working with local law enforcement to do the DEA Take Back event. If y'all ever heard of that, it's an opportunity for people to drop off any unwanted or unused prescription drugs. We do that because like around half of youth who get their hands on prescription drugs that weren't prescribed to them get them from unattended medicine cabinets or family and friends. So if you have that knee surgery and you have a bunch of like painkillers and you're good now, get rid of it if you can, and don't flush them because that's not good. That's not good. So
Okay, so a little bit about our mental health program. So Next Step Community Solutions provides school-based counseling in 68 school campuses. Jared a little bit ago asked, like, what counties do y'all serve? Well, we're all over the place. We're basically as far as Navasota and Mount Pleasant, all the way to, I'm trying to think what's like Waxahachie, Midlothian, Spring Hill. So we're on a lot of districts, 10 districts to be exact, and we provide school-based counseling. So what that means is that, so Next Step saw that there was a need for access to services, mental health services, and transportation was a barrier. We learned that transportation, insurance was a barrier. So we were like, you know what, there is this great service that we can provide, and we can actually provide that on school campus. So the school staff will make a referral to our Next Step counselor who is on campus, and then we'll see the students. Our waiting list, if any, is about 10 days. So we know that places like organizations in the area usually have a 3-month to 6-month waiting list. So we are very fortunate to be on campus, and our waiting list is about 10 days. So family support services. So we are, it's a very young program, but the goal is to provide parents with information that could be like, let's talk about how to learn about suicide awareness. Like, what does that mean? So our family support service focus on just serving the family, because, you know, we're working directly with the individual on school campus, but we also want to provide family support, and that's through parent meetings, providing resources. Our suicide prevention program. So we're currently on 29 school campuses, and this year we're projected to be on 40. So what that means is that we go to different schools, we'll contact them and say, hey, you know what? There's this suicide prevention program that we can offer for free on your campus, and is supported by Next Step staff. So the goal of this program, it is an upstream prevention program. So what that means is that we're helping students with identifying what are their strengths, right? We're not focusing on sad, shock, and trauma. We want to focus on things like, hey, who helps you when you're having a hard time? What physical activity do you do when you're struggling? Do you know about mindfulness? What's spirituality to you? So we focus on this wheel right here. And this is how we start those conversations with our students. And we also talk about trusted adult, which we'll get into a little bit later.
Yeah, that's right. And as you mentioned, all of these programs are free. I think counseling serves about 1,000 to 1,500 students.
Yes.
Approximately.
Yes.
There's free mental health counseling.
Yeah. And last year we provided 17,000 sessions.
Yeah. So
Yeah.
pretty cool. One thing that I neglected to mention about the prevention side is we have a new youth development program, which is a soft skills curriculum that serves kids in disciplinary alternative education programs, or DAPs. So if they get in trouble too many times, they get sent to an alternative campus for vaping or fighting or whatever. So we have a soft skills curriculum that serves them. And we also do juvenile probations in the summer. We piloted this program last spring with about 10 kids. This fiscal year, we finished up, we had 183 kids that we served.
Wow.
So it's grown quite a bit.
Yeah, it really has.
Can I ask a question?
Absolutely.
Since you brought up DAE.
I will. Yes, you can, please.
I'm Amy, I'm the program director here at CASA. So are you referred to these kids through teachers, school staff?
Yes, so the school staff will partner with them to launch the program, and then they'll self-select who they want to be in the class. We usually have groups about 8 to 10. And so the DAP principal or the superintendent or whoever we have a really strong relationship with, they're the ones who will fill out a referral form for each of the kids.
We have a lot of kids in DAE.
Yeah.
So,
And I want to just share with that because, oftentimes when we're presenting, parents will say, well, can I make the referral? Because the way the system works for us is that the school staff will make the referral. However, if you know of a need, please call the school and say, you know what, I would really want to see the student in this service, and this is why. So please advocate for them.
Yeah.
We encourage you to do that.
Absolutely. Happy to have a conversation with you.
Yeah.
After if you
I
want.
have a quick question.
Yes, please.
An Alabama CASA advocate, and you'll probably hit on this, but what is the grade level for the suicide prevention?
Yes.
How often do they meet with that?
Yes, great question. So our suicide prevention program, we are at junior highs and high school, so 6 through 12. We're currently in most of the surrounding areas. If you go to our webpage, you'll see it. It's really hard for me to remember all of the districts we serve, but I know we're at Spring Hill, we're in Tyler ISD, we are White House ISD, Bullard ISD. This year we'll be at Athens, Kilgore. So we're at both campuses. So if you call, and the goal of this program is we provide a training. It's an 8-hour training with students and staff. So it is very collaborative. We call the staff who signs up to do the program, they're adult advisors. And those students are peer leaders. So the goal is for them to not only be part of the sources group as individuals, but to spread that throughout campus, right? We build campaigns where we do a trusted adult campaign where students will display, well, Miss Alva is a trusted adult because of Y and Z, or Miss Erica is a trusted adult because of this. So we really would like to spread it across the entire school system. And the way we select students is we want to make sure that we have every student from a lunch table. So we're not just picking those, students in athletics or band. We want to make sure that everyone, those outliers, are coming into this program. So that's the goal with choosing who is in the program. We meet once a month. So, and that's how often we'll stay on campus, but.
That's right. It's like we call it like the breakfast club model.
Yes.
We have kids from each different types of groups.
Yes,
Come up.
absolutely, yes.
Leaders in their respective
Yes.
groups. So these are our referrals for counseling. When teacher staff make a referral for students, about 12% of them are for suicidal thought or ideation.
And this is just for Waxahachie ISD. Unfortunately, that number has increased. And why I say unfortunately, we know that it's happening, right? But we're very fortunate to be able to serve those students. So there is that, we know that these students are seeking services. So go to someone they trust and say, you know what? I'm having suicide ideation. So this is how we're able to collect this data. And because we're licensed professionals, we have to do assessments and all that comes with it. But there is some sort of intervention when a student has disclosed suicide ideation.
Sure. So this is data from the 2019 Youth Risk Behavior Survey. This is conducted by the CDC every other year. I think they do it every other odd year and they publish it in the even year. So there should be a 2023 one coming out pretty soon. But this is all grade 9 through 12 survey respondents. So you have 41% who said that they reported feeling sad or hopeless every day for at least the 2 weeks in the past year. 21% saying they seriously considered suicide in the past year. 17% making a plan about how they would commit a suicide, and 12% reported attempting suicide in the past year. This is pre-COVID numbers. A lot of these have gotten worse since then. So as you can imagine. So highly recommend y'all check it out. It's the Youth Risk Behavior Survey. You have to probably use some of that data for your work. The CDC does it every other year. So it's pretty good information.
Oh, so now the activity. I love this part.
Yeah.
So there you have some handouts. And one of them has trusted adult qualities. So if you're sitting close to someone, I want you to list what qualities do you believe a trusted adult should have? So, and that could be something maybe that within yourself, you're like, this is the things I do. Maybe this one was someone I trusted when I was, a student, and this is the qualities that they had. So please feel free to fill it out however you want.
You got to do it for that.
Yes, we got 5 minutes for that. Assuming maybe everyone's done, I know that's pretty quickly, but it really helps like engage in conversation. If you want to share who here had a trusted adult when they were a child or, in your teen years, raise your hand if you want to share. Okay, that's awesome. That's oftentimes a question that we ask students, like, hey, who in here? And oftentimes not everyone raises their hand, right? And we know that, not everyone has the ability to have a trusted adult. Maybe they feel like just because it's not a parent is not a trusted adult. Can someone share what they wrote as the qualities? Who wants to share? Okay. Or yeah, both can. Do you want to go first?
Okay. We said someone who demonstrates that they care, a person willing to spend time in a child's life, quality time. Just give a listening ear. Someone who's confidential, someone that's dependable and they'll do what they say they will. And someone that can mask their own personal feelings.
Very good.
That's very good.
So we can master what? Mask their own personal feelings.
So this was somebody from the chat.
Oh, awesome.
They mentioned that somebody who listens to them and then an adult that has empathy.
Those are really good ones too.
Really good.
Yes, most definitely. And, at school, when we're talking to our adult advisors, we, oftentimes say, hey, like, not everyone identifies as a trusted adult either, right? So but when we do, what qualities do we want to make sure that students see, right? Or know that we have? Or maybe we want to list something that's like, hey, I am a trusted adult outside of their door in the classroom. So here I provided you with, this is the things that we say, these are the common things that oftentimes students want to see, they want to know that someone cares, that they're listening, that they're validating their feelings, that they can trust, right? So thank you for filling this out and sharing. And here we are.
Yeah.
So any adult who exhibits attitudes and behaviors towards youth that can contribute to the youth's sense of well-being. So a trusted adult can be anyone. And I'm assuming most of you in the room play that role with the students you serve. So
yeah, it's really cool when we do a trusted adult campaign on school campuses. We really try to encourage students to not just think of their teachers, but to all the staff on campus who could be someone that they could go to if they knew someone was going through a crisis and they could get help.
That's right.
Yeah. Cool. So we'll talk a little bit about the difference between suicide and self-harm. So non-suicidal self-injury or self-harm, cutting, hitting, kind of pulling or burning, that kind of stuff, those are self-harm. It's not necessarily suicidal ideation. It can a lot of times just be a coping mechanism for them to deal with their stress or anxiety. I'm sure y'all are very familiar with that. Help should be sought even if you're not sure whether it seems necessary. So I think the main difference is self-harm, it's a coping mechanism,
Right.
you're picking, you're things like that. And then, and then suicidal thought is, obviously the ideation of wanting to
Mhm.
complete suicide or making a plan for that as well.
That's right, yeah. And those are the key factors, is having a plan versus something that they're doing as a coping mechanism. So if you're not sure, sending the student to a mental health professional or to the hospital or to the person who completes the assessment is super important.
That's right. Yeah, thank you. Yeah, so here's some warnings.
Yeah, so the warning signs, so that looks different for everyone. Research says that there's no specific list of what are the key indicators of when a student is attempting suicide or has suicide ideation. So here is listed by, and you have a worksheet. We provided you with, not a worksheet, a handout that lists all the warning signs. So we have if a person talks about it, what are they saying when they're talking about it? They're saying maybe they want to kill themselves. They're feeling hopeless, being a burden to others, or feeling trapped. There's also going to be some behaviors, increased use of alcohol or drugs, looking for a way to end their life, withdrawing from activities. Maybe they're in sports and they're always going to practice, but all of a sudden they stopped. So sleeping too much or too little, giving away prized possessions, almost like saying goodbye. So maybe they're cleaning out their locker in school. Maybe you notice that their favorite items, they're giving them away. Those are warning signs. And then mood, depression, anxiety. And sometimes you would never imagine that this person is thinking about suicide because they were happy. They appear to be content. So while these are some, there's also the opposite of that. The mood could be that they're fine.
Yeah, at peace.
Yes, at
Yeah.
peace.
Right. So there's a model that we have, and it's on that worksheet with the blue top banner.
Yes.
It's called ANGEL, and it stands for, we'll get into the acronym.
Yeah.
But the first one is ask. If you are picking up on some of these warning signs and you're worried about the youth that you're working around, you can ask them directly if they're thinking about suicide. A lot of times they won't tell you or giving any indicators. So sometimes you just have to kind of be very upfront and ask, hey, are you thinking about suicide? Are you having suicidal ideation? Are you making a plan? So that's the first part of Angel. Try to find a suitable time and place to make sure it's appropriate, make sure that they feel safe, or in a safe position when you ask that question. If you're picking up on some of those warning signs. And if they don't confide in you, it's okay. Maybe try to encourage them to talk to someone that they do trust a little more and want to confide in. So, second one is be non-judgmental. Of course, we can probably all agree with that. Focus on your concern for their well-being. Don't be accusatory. Say things like, hey, I noticed that blank. I've noticed that you're doing this. I'm just worried about you. I just want to check in, make sure everything's okay. Just ask questions. Don't be pushy though. So just ask questions. If they don't want to confide in you, like I said, in the first one, just try to encourage them to talk to somebody that they can confide into. And then the G, give reassurances, have realistic expectations, give them hope, tell them it's going to be okay, provide information, try to encourage them to talk to people. Again, don't make promises you can't keep. Don't try to give advice that's outside of your wheelhouse. Don't dismiss the problem. Don't say, oh, you're just a teenager. Everyone goes through that. People experience stress and trauma differently. Okay. Don't try to fix the problem yourself. So just try to connect them to a resource that they can tap into to seek help. So next one.
Encourage.
What was the last one? I was trying to read.
Yeah.
Give
Yes, please
reassurance,
do.
sorry.
Was it-
Oh, don't engage in communication that is belittling or sarcastic.
What about using, sharing your own story? Maybe you might have a daughter or a son who's kind of been in a similar situation.
Yeah.
Is that probably something that you should stay away from?
No, you can't. I wouldn't tell them I wouldn't be like, the result's not going to necessarily be the same just because you're in a similar situation. People deal with stress differently. So you can say, I can kind of relate and I've gone through similar things, but it doesn't mean that they're going to have the same resilience that you had in dealing with that problem. So just kind of be aware that people deal with the same stressful situations differently than others. Did you want to add to that?
Yes, and depending on who you're talking to, sometimes self-disclosure is not the best way to kind of give advice. But it just depends who you're talking to. Are you talking to, a young adult? Are you talking to an adult? But oftentimes it's just not recommended to share, just because, like Joe said, the stress, the story, the ending could be different for everyone. Yes, that's a really good question. Thank you for asking that.
Yeah, it's great.
So encouraging to seek professional help. What does that mean? Depending on where you're at, if you're at home and a child has disclosed suicide ideation, that would mean, hey, let's go to the hospital. At the hospital, they'll fill out an assessment. Depending on the severity, if it's high risk, they may be hospitalized. That can also be really scary, right? Not knowing exactly what's going on, what's happening, but reassuring them that I am taking you to help because I care for you and because you're super valuable and important to me, and this is why we're seeking help. Confidentiality. Okay, just to kind of put myself in your position. So you're working with students who you're an advocate for court-appointed students.
Foster care.
Foster care, that's right. Okay, sorry. Like we work with so many agencies. I'm like, so you have frequent contact with these students or patients. What do you call them? Clients? Is that the word? And so depending on where you're at, that's how you're going to make the recommendation. Do you all provide suicide assessments?
No.
Who do we refer to?
Counselors usually.
Perfect. Okay, yes, that's where we were encouraged to seek help at. It would be to going to a counselor.
Yeah.
Mhm. Listening. Oftentimes it's a really scary topic, right? And sometimes as helping professionals, the first thing we want to do, we want to help and be like, no, but it's okay. Like if you do this and that, you're going to get out of this, it's going to be okay. But sometimes we just need to listen. And we need to listen with empathy. Somebody mentioned empathy earlier, like, listening and being concerned and not disregarding or dismissing what they're feeling, saying like, hey, it sounds like you're really having a hard time. Let's talk about it. And then just allowing them to share that, and our response is being careful with how we respond to that. If we're like, oh no, the child may not share it anymore because they're like, oh, this is not a comfortable conversation. But if you sit down and you're like, I'm really concerned, let's talk about it. And then you just start listening. And that's one of the recommendations. And this really works, y'all, like just listening and then just saying things like, I noticed that. And then try to be accepting even if you don't agree with it, right? If we're like, really, that's why we wouldn't want to say that, but just agreeing and realizing that their problem is a big deal.
And when you say accepting, what do you mean? Like, give an example of that.
So accepting what they're feeling is just validating.
Oh, okay.
Yes.
Now, is it also, would this make things a little bit worse? Because after listening, like I will listen, of course, but is it okay, like, to remind them of how valuable they are?
Absolutely, yes.
And like,
yes.
Yes. You're so special, and I know you're gonna change, things
yes.
like that. Just,
yes.
We would. I can't imagine life without you. Things like that. Should we stay away from those things? Like, you mean so much to.
Yes, you can. Yes, absolutely. Like, let them know, reassure them that they matter. They're valuable. Yes. Reassuring them. But yes, absolutely. You can do that. It's hard because depending who you're talking to, our responses can be different.
Yeah.
But just being really careful and using this, like I always think, like Angel, when talking to students, using this acronym to kind of help us, and just going back, like, are we being judgmental when we're saying this? Are we encouraging? Are we listening? So just using this model to help students.
Right. Yeah, that's good. A couple of good reminders: just remain calm, don't judge, provide constant supervision, and remove means of self-harm if you see them. Yeah. I think, talking about the like Angel a little bit, one example that I think a lot of us have probably experienced is you're a teenager and you're going through your first breakup or something, and a parent or someone is like, oh, shut up, you'll get it for it. They don't have, these youth don't have really the frame of reference that adults have to know that it's going to be okay. You'll be fine.
Right.
It may be like the worst day of their life up to that point. Right. So just kind of be aware of stuff like that.
Yeah, so we shouldn't say save your tears, honey. It's gonna get worse.
Yep, that's right. Yes.
That's right.
So true.
Get ready for when you're 30.
Yeah.
Whatever.
So
That's right.
Who in here has heard of 988?
Oh, I haven't.
Fairly new, so I just recently changed a couple years ago now.
Yeah.
Yeah, a couple years ago now. So now this 988, if someone's going through a crisis and they are needing to talk to someone, or if someone has a friend who is going through something like that and they just need to talk to someone, they can call or text this number. So please, if you know anyone, this is always, and it's super easy to remember. Before it was like 1-800.
Yeah.
It was a long number. So this is a lot easier to remember. You can call or text. So please share this information with anyone who needs to talk to someone.
Questions?
So I'm curious about, so, sorry, this is my old classmate, so we're.
Yeah. She's gonna pick on me.
So, in situations that maybe the child is attention seeking, like it's not the first time they've done this, it's a constant. What would you guys do, or what would you advise us to do in that situation?
That's a great question. So our protocol, so we follow a suicide assessment protocol where we never disregard when a student is sharing suicide ideation. We take it very seriously. When we complete the assessment and we realize that there's a plan, we know that they're high risk and we know they need to be hospitalized immediately. I would leave that for whoever's filling out the assessment to make that decision. But yes, we've heard that sometimes, like Joe said, they're going through a big breakup and they're like, you know what? I'm done with life. Like, this is it for me. And it's the worst day of their life for them, but they're not able to rationalize like, hey, I'm gonna have other girlfriends. That'll be fine. But yes, I wouldn't make that decision. I would still make the recommendation for the hospital or talk to the counselor and they fill out the assessment. But yes, that does happen. And thank you for asking that.
So if we have a child that we think would be great for this program to have individual counseling in school, we cannot refer them. We would need to get in contact with the school to refer them for
Yes.
counseling. Okay, I just want to make sure.
Yes.
And
And
is it
please,
normal? Is it like typical, like it is a licensed professional counselor?
yes,
that-
yes.
it's not just like there's a difference between school counselor.
Yes.
Okay.
So we have 18 licensed clinical professionals. So they have different licenses, like we have clinical social workers. We also have LPCs, LMFTs. So all the acronyms when it comes to licensed professionals, but they're all clinicians and therapists. So yes.
Yeah. And you can get the full list of the schools we serve on our website.
Yes, I think it's on the brochure.
Okay.
I think.
Okay. Maybe.
Yeah, maybe. Yes,
The majority of our kids are already seeing counselors
yes.
for trauma history to address trauma, abuse
Okay.
and neglect. So I'm curious, like, I'll give you an example of a kiddo that I just visited with, and he's only seeing his counselor once a month. And that's contracted through Child Protective Services.
Got it.
That's what's being offered to him. And, our kids have such a trauma history, it really needs to be unpacked. We'll use the verbiage, it needs to be unpacked and everything really dealt with. So I'm curious if this program through the schools is something that could really help with that, with consistency and.
Absolutely, yes. So our counselors, we tier our students because we know the need is high, right? So basically, depending on their need is how often they're going to see the counselor. Oftentimes our tier ones is who we refer to sources because we know that they're getting a lot of that, although it's not a therapeutic group, they're still getting a lot of the language that we use.
Yeah.
They're understanding their strengths and protective factors. But if a student is a tier 3, we would see them weekly.
And they can't see more than one counselor. They're already in.
No. If they're seeing an outside therapist, they can't. They have to choose to only see one. Unless there's really clear communication within 2 providers, but that could be super difficult, especially with 2 different organizations. Yes.
Do you know what, if any type of, like, Do y'all typically do cognitive behavioral therapy?
So, yes, so our counselors, they will tailor the interventions based on what's going on. So let's say that they're struggling with academic achievement. So they're probably going to use CBT. If they're struggling with anxiety, they're probably going to use mindfulness and CBT. So depending on the student's needs is the intervention they're going to apply. But they're all licensed professionals, so they have, the training to use all the therapeutic modalities and approaches.
Yeah, of course.
Great question. Thank you for asking.
Well, I'll just tell you, so many of our contracted therapists are overloaded and overextended. And so, consistency for our kids is often an issue.
Mhm. How many students are seeing a therapist? Like, do you have that number out
No,
of the students you also?
we typically serve between 500 and 700 kids a year.
Okay,
And we have 3 counties. Our program here does, but our kids are across the state of Texas
Sure.
and out of state, but, we have a lot of kiddos that are in East
Yeah.
Texas, placed with relatives and foster homes. And
yeah,
so it's more of an issue of just the intervention that the unprofessionals think they need.
Mhm.
Because we know the kids, we develop the relationships with the
That's
kids.
right.
We are supposed to be the trusted adult.
That's right.
That's right.
So, knowing what the kid has experienced already.
Yeah.
And having someone consistently, because we are not therapists
Mhm.
and we don't want to pretend to be.
Right.
But we know that our kids need this type of intervention, and it takes consistency to get them to
Yeah,
open up.
yes,
And once a month on the phone or on Zoom is not.
it's hard.
We don't really feel like, I don't feel like it's addressing. the
Yeah,
needs.
I mean, I'm super open to having a conversation of how we can create a partnership to better serve your students. Does that mean that you are like, if a student's attending the school districts that we serve, do we put them at the top of the list? I'm open to talking to you about what that can look like. Do we need to bring a therapist here? There's a lot of possibilities that we can explore. So I would love to talk to you more about that.
Yeah, it's spot and go. because
Yes, I know.
We have some incredible counselors.
I'm sure,
Yeah.
yes.
That really are specifically trained in trauma and how to, relate that with the kiddo. So, but we also have some that are just overstretched.
Yes,
Yeah.
yes.
And we wish that we want them.
Yes, no, yes.
Yeah.
I mean, it is, like I said, there's some agencies that have 3 to 6 month waiting lists for mental health services. So we know there's a need. We oftentimes get on the whiteboard and try to explore how can we better serve the population? Do we need to bring groups? And therapeutic groups are super effective too with depending on the student need. But I'm super open to just having a conversation with you and just seeing what that could look like. Yeah.
Yes.
Besides the wait list of maybe it takes 2 to 3 months to get, once you get a referral to get in to see someone, we may change their location.
That's true.
And then you have to reestablish, there has to be some way that there can be with technology that.
Like virtual.
To be somebody you connect them with, that they stay connected with that therapist, no matter which home they go to, what county they go to, what state they go to. If they have built that trusted relationship, there has to be some way that this can.
Yes.
So they have somebody they can call.
Yes, I agree with that.
Not just 988.
Right. Someone they trust and that they build rapport with. Yes, I completely agree with that. And that's part of the reason why school-based counseling works. That's the students' environments. There's school every day. They spend 8 hours out of their day to be, in school. So I mean, I agree. There needs to be a system that helps tailor the need, especially because they're having to relocate. just you talking, I'm like, oh, we could do this, we could do this, we could do, but we need a lot of money for that. And we need a big plan for that and probably a whole organization to do that. But yes, I agree. I hear you. I also see the need and I'm sure that's super challenging, especially when it's someone you're working with directly because you want them to be successful. You want them to trust someone. So,
Yeah.
I'm sorry, but I hear you.
I have a hard question.
Yes.
So it's always these kids that surprise you that do it
Mm,
and pass, and you look back at, you blame yourself, and it's that huge question, what did I miss?
mm. Right. Yeah.
And I know because I've already studied your list of warning signs,
Mhm.
but we also have those kids that you don't see any of that.
That's right. That's right. Yes, thank you for bringing that up. And that's when I was going through the warning signs, I didn't see that in our mood. There wasn't like normal, happy, nothing has changed.
Mhm.
And we know that oftentimes people will say like, we would have never guessed that. They look so happy, everything looked fine. And sometimes we just we're not able to notice it. And that's really hard because, when we're like, I'm a trusted adult, but we don't know that it's hard. And it almost feels like I should have known, but I hear you. I hear you. We serve a lot of school districts and unfortunately we've had student deaths by suicide. And it's really hard because they weren't in our counseling. They weren't in counseling. We didn't have a suicide prevention program there. So it's like, how did we miss this? Like, it's so hard. It gives me chills just thinking about it. It's definitely a hard question. Thank you for sharing. And that's super vulnerable. Like it's hard.
Y'all might have already said this and I probably missed it or tuned out.
That's fine.
What ages do y'all start with? Is it just like all around or is it just?
For counseling, it's K through 12. So for example, we're at Bullard, we're on all of their campuses.
Okay.
At Spring Hill, we're at all of their campuses. For the suicide prevention program, we have an elementary model. It's been so hard to sell.
Mhm.
Like, it's like we go in there and we're like, we have this great program for free. And they're like, sorry, we can't do it. Teachers are also overwhelmed with the amount of work that they have to do. So I am like, yeah, I don't blame you, but we do have an elementary version. However, we haven't implemented it anywhere just yet, but it's 6 through 12 for sources.
Do y'all serve any adults?
Not
Not
counseling.
indirectly, because
Okay.
they're like adult advisors. So they're part of our program, but not,
We do sources of strength on Wiley College. So
Okay,
young
that's right.
adults.
Okay.
that's right.
And we do a lot of like speaker series where we talk about substance use and suicide prevention
Mhm.
and mental health with them.
Okay.
And we would like to expand that program to other
Yeah.
colleges, but Wiley College is the only one that we're at now.
Yes,
Okay.
yes. So if you guys have any connections with colleges,
That's right.
Yes.
not me trying to sell the program right now.
I know.
Any other questions?
All right, we so appreciate y'all having
Yeah.
us.
Thank y'all.
Thank you. I hope you guys enjoyed it. If you have any questions, you have our emails, phone numbers on there. Yeah, it's been a pleasure just kind of hearing your input and hearing your trusted adult qualities.
That's right.
Yeah,
Thank y'all so much.
thank you.
Show the slides.
Oh, yeah, here's our
Yes.
information if you'd like.
Follow us
Follow
on
us.
Facebook and Instagram.
I will say you'll have a great social media presence.
Thank you. Sarah is
Sarah's
our
great.
marketing director
Oh,
and
good.
she is like the best.
Yeah.
She did all those stickers and clips and all that, y'all. She-
Yeah, yeah, yeah.
Oh, yes.
Very trendy.
Yeah.
Thank you very much.
Well, thank you all so much for being here today.